We get patients who have very few teeth that are worth keeping. Those patients benefit enormously from implants in the lower jaw because the lower denture is always a problem. Upper dentures, if they're made well, will succeed pretty much 99% of the time and be well accepted by the patients. But lower dentures are a bit of a nightmare, and they have always been that way because you've got a horseshoe of gum, a denture sits on that, it's got moving lips in front, a moving tongue in the middle and moving cheeks on the outside, and we expect the denture to sit still, and needless to say it doesn't. So nowadays we put either 2 or 3 implants in the lower jaw in particular locations, and onto the implants we put precision attachments, which allows the denture with the opposing precision attachment to clip into the implant precision attachment. It means the denture stays put. The patient can still take it out for cleaning, and in fact they must do. They must take their dentures out at night, and they must clean around the implants to a level of near perfection to make sure that they don't get gum inflammation and the equivalent of gum disease around implants, because that can go on and lead to bone loss. So I reckon that placing 2 or 3 implants in a lower jaw to support a lower complete denture is probably one of the greatest benefits any patient can enjoy, because it transforms them from being nearly a dental cripple to being able to eat all the foods that they would like to eat. There are other patients who have generally very good teeth, and they may have one or more than one tooth or teeth that have failed for whatever reason. It might be due to trauma, a road accident or an assault. And those patients benefit enormously because instead of having to wear a removable plate or denture, they can have something that's part of them. For young men and women, wearing a removable plate or denture can be very, very upsetting. It can take away an awful lot of their confidence, and in the end they become much more shy and withdrawn. I think it's great when you can take a patient like that, put an implant in, give them very, very realistic looking teeth on the implants, and they never have to take them out. They just clean them in the way they clean their own teeth. They still floss, they still do all the things that they do to their own teeth, but they are part of the patient. And so the patient almost, well, they forget that they've got implants. Within 12 months, it's something in the back of their memory, and they get their confidence back. They can eat anything they want. Obviously, we want them to wear mouth guards when they play sport and so forth, because we don't want any of our work being damaged. And it's an expensive type of procedure. Implants are not cheap, and nor is the crown work that goes on them, but it's very realistic. And nowadays, with modern technology, modern equipment and modern materials, really you can almost make a tooth look perfect. There are many times when I see patients after I've finished and I can't tell which tooth is the implant crown and which tooth was theirs. So that's the level of care that we want to offer, and that's the level of care that many patients receive. Patients sometimes are unfortunate and they suffer from lesions or pathology in the jaws, maybe cysts, and this is probably the more common pathology that we would see in patients' jaws. You might see a cyst that has taken away all the bone around a series of teeth in the same area, and they come to have those teeth removed, the lesion removed, and then we have to consider reconstructing them so that they don't have a series of missing teeth. Bone grafting comes into the fore there because we can replace the missing bone that the lesion has eaten away, and it's a stage-by-stage, really a stage-by-stage reconstruction, first of all of the jawbone, and then of providing them with teeth on implants. Those are the patients who are probably the most satisfied and grateful, because it's not through any fault of theirs, it's not through not caring for their own teeth, it's an unfortunate occurrence, and that they really want to get back to where they were. To be able to provide them with all the bone that they had and then to give them all the teeth that they had is the most satisfying part of implant dentistry.